All right, we're all good. Welcome, everyone. Happy Monday. Thank you all for joining on this Monday evening, whether you are watching now or at a later date. Of course, this video will be here after, so feel free to click on it whenever you have some time. Today, we are joined by the lovely Emmalinda and Gregory from More Than Sex Ed. I'll have them introduce themselves in a moment, but before we get started, we do have a code you can use for getting $5 off on your online doctor's consult. So I'll have that flowing throughout. So if you want to jot that down, feel free to do so. And don't forget to sign up through Pandia Health for your birth control delivery. I got mine last week. It was great. Free. They give you candy. And if you have any questions about that, feel free to drop them in the comments below. Did you have a question?
There's candy involved?
There's candy. It's so nice. They give you little like chewies. It's very cute. And they give you a little card as well with like a Q&A about your birth control, which I really thought was nice. So yes, it's very thoughtful. They make birth control a lot of fun. So it's appreciated. All right, so let's get started. I'm just gonna do a brief intro for you, or I'll have you do a brief intro for yourselves. So if you each just want to say like your name, a little bit about yourself, and then we'll dive into what More Than Sex Ed is.
Sure. Hi, I'm Emmalinda McLean. My pronouns are she, her, hers, and I am the program director and one of the co-founders of More Than Sex Ed.
Awesome. And my name is Greg, and I use he, him, his pronouns. I am the coordinator for More Than Sex Ed. I'm our administrator and also one of our facilitators, and I'm super glad to be here. We're really grateful to be working with Pandia.
Awesome. The feeling is mutual. So could you just tell us a little bit about what More Than Sex Ed does, your mission statement, all that good stuff?
Sure. We are a sexual health education nonprofit based in Los Angeles. We've been around for about 5 years. Our mission is to nurture healthy development through honest conversations about sex. So we go to various schools around Los Angeles, or we went there before lockdown started. Now we teach classes online for mostly middle and high school students, covering all aspects of sexual health, relationships, communication skills, uses of power, feeling good in your own body. Greg, fill in what I'm missing.
Good conversations, a number of topics. We also have some curriculum on anti-racism and justice, equity, diversity, and inclusion right now. We're still field testing that at the moment. So we do a lot of different things. And I'm seeing a hello from Angela. Hi, Angela. We're so glad to have you on, or Angela Ray, rather. I apologize.
Awesome. Yeah, that is all great stuff. Super relevant, especially with all of the inclusivity. Right now, I know there are a lot of health and racial disparities when it comes to birth control. So I'm really glad you mentioned that. All right. So just to kick it off, my next question, well, I guess I'll say what the topic is. If you didn't see our little banner at the bottom tonight, we're talking about how to be single during the pandemic. If anyone has ever seen the movie How to Be Single, this is like reminding me of that so much. If you haven't seen it, go watch it. It's a very cute movie. But yeah, so that's what we're talking about today. Again, super relevant topic, very exciting. So let's just kick this off by me asking you, what do you have for what tips do you have for people who are interested in dating right now? Either of you can kick it off.
Greg, I'm going to throw it to you.
Being the resident single person, I'll talk about some of that. The bigger things are starting to negotiate your own limits. And it's really important that you know where you are and where you want to go in terms of developing a relationship. If you want to meet people, it's always a good idea to meet people in person if you wanted to go a little bit further than that. But obviously, we have to take some precautions right now. So think about what are good, well-ventilated places that you could meet in public. Maybe you want to go for a walk. Maybe you want to go to a well-ventilated marketplace. Maybe you want to go to the park. There are all sorts of things that you can do in order to meet people in person, still have physical distance of 6 feet or more. Remember, 6 feet is a minimum. There's no maximum distance that you can be away from folks, but the further away you are, the more difficult it's going to be to have a conversation. But even then, do you want to mediate that? Could you use your cell phone and still be outside with the person, especially if you're in a jurisdiction where caseloads are on the rise? It's not really a great idea to meet new folks right now. If you're living with other folks, you also need to consider what are the ways that you're going to integrate this person or these people into your pod. If that's something you actually have to have conversations with your roommates, you're not allowed to just date anyone you want right now if you also want them to be physically present in your household, or you're going to be meeting with them outside of your household and carry the risk of exposing your household to germs or contaminants in general that you don't know about. I think one of the great things about this time of deep discernment, as we're required to be inside more and more frequently. I don't know about you, but I haven't really gotten sick this year, and that's largely due to wearing masks and not being in public as much. So, like, keep that in mind. On the other side of this, whatever the world looks like, you might also want to consider, like, is this person worth getting a cold for? If this person is not worth potentially getting a cold for, you may not want to meet them at all.
I want to say hi or give a wave back to CJ and Alec, who have waved at us in the comments thread I'm looking at right here. +1 to everything that Greg just said. I will also encourage someone to ask themselves, what is it you're really hungry for? And first of all, work on unpacking whatever guilt or shame you might be feeling about what it is that you really want. If what you really want is sex, that is a very normal and understandable human need. And you are not obligated to want a romantic relationship just because you want sex. There are a lot of people who are sort of incidentally monogamous right now because they are only willing to go through the negotiation process of bringing one additional new person into their pod, as Greg was describing. But there are also a lot of people who are discovering that they are really hungry for human connection, and they are willing to have an old-fashioned Jane Austen style writing letters back and forth, or, FaceTiming and skipping the meeting in person because there are really high risks associated with that. And maybe someone who's been going through a lot of hookups and not a lot of deep having feelings conversations is discovering that that's really what they're hungry for. If you are really hungry for having more orgasms, there are a lot of fantastic electronic devices that can help you do that while safely talking to someone who's saying sexy things to you over the phone. And there is no shame in acknowledging whatever your emotional and physical needs are and being honest with other people in your life about what you want to do to get those needs met.
Yeah, no, very true. I liked in what Gregory said, the emphasis on insulated, well insulated in the place being making sure that you have enough social distancing, super important. And yeah, figuring out kind of what you want in the relationship. I think there's probably a lot to be said for kind of building up to eventually being able to meet the person in person, and you actually get to see if you like each other more than just the physical attraction. So that's actually pretty awesome. That kind of brings us into our next topic. So if someone is choosing to do online dating, which is of course still a great option if you are doing it safely, how do you manage doing that safely? Of course, there's catfishing. There's just a lot of things like that. I know a lot of people who have been catfished myself. So what are some ways to kind of get around that safely?
Awesome question. So the principles of being safe online are true regardless of what you're doing online. People can pretend to be anyone on the internet. If you want to go into FaceTiming, that can allow you to establish that someone is who they say they are. I know people who have gone the step of asking to interview a friend or a roommate or a family member. We are in unprecedented times, and whatever steps you feel you need to take in order to ensure that you are being safe and protecting yourself and your loved ones, if someone is not respecting your safety concerns, that's a giant red flag.
True.
Absolutely, and I'm gonna build on that as well. Don't forget that all of the tools that existed before still do exist. You can do the old-fashioned Google. You can Facebook them. You can look at their high school yearbook photos. Whatever you need to do in order to make sure this person is real. They're saying things in public that you wouldn't mind being associated with in public around that person. Some people have really good relationships, continue to have good relationships with people they're no longer dating. That might be a really good sign for you that this person is interested in meaningful human relationships beyond just a romantic relationship. And that would be a really great sign that this is someone worth investing some time in.
There are a lot of great tips that we can take from the BDSM community on ensuring that someone is safe to engage with. Asking for references of other people that this person has dated or been with can be a good way to ensure that they are willing to be open and honest and meet your comfort level. I will also say, with regard to going on dating apps, some people feel like there is some shame associated with being on the apps. They can be a lot of fun. And if what you are really hungry for is getting the ego validation of someone thinks I'm cute, you can collect those messages from strangers without ever needing to talk to any of them. And that might be what you're really hungry for, is some attention. And there's no shame in that. There are also, you can Google ways to hack the algorithms of dating apps if you are not getting the kind of attention that you're looking for. Some tips off the top of my head are that changing the text in your profile and adding new photos more frequently will boost your visibility. So if you would like to be seen by more people and you're not getting the kind of clicks that you want, even just changing a few words in a sentence in your profile, like every day, will increase your visibility in the algorithms. Fun fact.
Wow. Yeah, I totally didn't know that.
There's also, you had mentioned about catfishing a little bit earlier, and I wanted to return to some of that information. Just remember that if you are an adult, you get to decide what you do with your body and pictures about your body to the extent that they impact other people. So it can be a sign of harassment for somebody to really demand pictures of you. At the same time, you might really enjoy exchanging erotic or even nude photos of yourself with other people. If you're an adult, those are decisions that you get to make. There is some online etiquette. Adult meaning over 18, yes, not just mature. You need to be over 18 in the jurisdictions we're talking about. We're here in the US. There's some etiquette around sharing photos, who goes first, who doesn't. If you're in the type of app where you can share additional photos just inside the app so that you can lock and unlock them, consider that as an option as opposed to sending them directly inside of the app. If you're a little bit more comfortable moving it to a different platform, maybe a more anonymous platform, so like a WhatsApp or some type of a secret messenger service, you may want to connect with people that way. You might even want to make sure that you actually have a phone call with that person before you share any more information beyond what's already on your profile. You get to make a lot of decisions about how you do that. And no, it's not too demanding. No, it's not too needy. Yes, people do this. So if you're unfamiliar with it, unaccustomed with it, or feel like it would be too burdensome to ask someone to do this, folks do this every day. It's absolutely all right to set up the boundaries that you need in order to feel comfortable and sexy.
Some legal considerations and risk factors to consider. Going to say it again. Any explicit image of someone under the age of 18 is child pornography and is illegal. It is also legally harassment to send unsolicited explicit photos. Sending an unsolicited nude photo of any genitalia or parts is legally harassment, and you can press charges for that. Most apps will also have a method within the app to report that kind of thing. It is illegal, at least in California, I don't know about other states, to send, even if a photo was sent to you consensually, to send it to others without the consent of the person whose image it is illegal. And the person whose image it is has the legal right to press charges. That doesn't mean that doesn't happen. Unfortunately, we know statistically that about half of nude photos that get sent are shared with someone who was not the intended recipient. So know that that's about a 50-50 chance, and that is a piece of data for you to weigh before you make the decision about whether or not you feel comfortable sending that picture.
Yeah, no, that's really good to know, that that's literally a law. I mean, of course, I've received unsolicited pictures. I feel like most women probably have at this point. Yeah, I know like some of my cousins who are really young in like 8th grade are like, oh, my friends are sending nudes. And I'm like, oh no. But again, of course, if you're a consenting adult and that's something that makes you feel good, makes you feel sexy, and it's safe, I think that's awesome. But it's when, right, it gets unsolicited that is a form of harassment. That's really good to know. Like, say it louder. Because I think a lot of women, people in general, of course, probably maybe a little higher in women, receive those pictures and don't really know what to do with it. So I'm glad you mentioned that. So changing topics just a little bit, for individuals who maybe are interested in dating but are mostly just kind of feeling lonely, now is a really tough time. I know I live by myself and I'm able to work, so I have interactions through that, but beginning of COVID, I was all by myself and it was really lonely. So what are some tips you have on that? Maybe not necessarily related to dating, but just kind of getting that fulfillment elsewhere.
Absolutely.
Yeah, absolutely. I know we work together every day, and so we've developed some of each other's mannerisms and even verbal patterns, and it's just lovely to see when that happens. So having some type of regularity to your day, whatever regularity looks like, is helpful for just getting in the habit of, hey, like each day is not actually an endless time that I am spending alone. So part of that is about those things. So that can look like taking a shower or a bath at a certain time each day, or at least once each day. It can look like making sure you actually get up and put on clothes, as opposed to keeping PJs on. It doesn't have to. There are a number of things that you can do to bring some type of regular schedule to your day. Eat your meals around the same time. If you have daily medication, continue to take it at the same time. Maybe set an alarm and give yourself a reward for having honored that type of stuff. So that's one way that just keeps you engaged and healthy and feeling good. Other things is, it's not a bad thing to reach out to friends or family members that maybe you haven't spoken to in a while. If Zoom or any other type of video conferencing software isn't really your thing, I know I really don't like to video conference for anything other than work right now. Rediscovering the intimacy of the phone call. Oh my goodness, I cannot see this person's face. I can only hear their voice, and I have to listen and interact with those people in a different way. Can be really cool and exciting and fun. Again, kind of that Jane Austen love letter. A love letter by any other name is a text message to someone you really care about. You can do those types of things too. I recently did some tabletop gaming with some friends through some online software. So what are things that you would like to do in person that you can still do if you just have it a little bit more mediated? What are things you definitely don't want to do now that you can't join together? Getting clear on, no. What I really enjoyed was being around all those people, and this won't work. So I need to figure out something else. Reach out to a friend or a family member, or even just a close acquaintance that you have at work that can maybe help you strategize about some of the ways that you can still enjoy the feeling of things that you used to do in person, or that require other people, while maintaining your ability to be alone and physically distant from other folks, so that we can get through this pandemic with as many people alive as possible.
I would add that it is a really brave and vulnerable thing to do, to ask for what you need and to be honest with people that you are close to and say, I am really struggling. I am having a really hard time with this level of isolation. Is there someone who I can just have a standing weekly phone date with, just to have somebody to talk to. Maybe it's even, can we eat breakfast together over Zoom so that I'm not eating every meal alone? Sharing a meal with someone can really do a lot for your heart. Maybe if that feels a little too vulnerable for you, you can put it out in a Facebook post or a tweet or whatever. Say, oh my gosh, I just finished Queen's Gambit and I really need to talk to someone about it. That could be an opening to, I really just need to talk to someone about anything, but why don't I put out the invitation? There is probably someone on your friends list who is also wondering who's up for just someone else to talk to right now, and being the person who says, hey, I'm here, I would love to talk about whatever, can be a lifeline to somebody else who might be in need. And there are also all kinds of, lifelines, chat-based services. If you are just looking to connect with a counselor, if you're struggling with something, there are services available. Crisis text line is available. LGBTQ youth can use the Trevor Project's lines, and Trevor Space is a chat space where people hang out. So there are services available if you do some digging. There are ways that you can connect with some strangers if you are looking to connect with someone who's willing to hold that space.
And no matter what, you're going to be lonely some of the time. If you are consistently lonely every second of the day, that might be a sign that you should reach out to someone else, maybe a medical professional or a counselor, for help and support additionally. But being lonely some of the time is normal and natural and healthy. And, it's going to be increased in this time of not seeing as many people. So, take your baseline of what loneliness might be, up it by times 10, I don't know. And if that times 10 is something that you're experiencing every waking moment, it might be a good idea to reach out for some additional support.
Greg and I pinging back and forth. If your baseline for not doing well is significantly higher than it is normally, I would encourage you to take stock of the boring self-care things that you could be doing to take better care of yourself. I will tell you that we know a lot of people are drinking a lot more alcohol under quarantine than they might otherwise, and alcohol is a depressant. I stopped drinking recently because I struggle with depression, and I realized that putting a depressant into my body on top of my baseline depression was not doing good for me. And I have been feeling considerably better since I stopped adding depressants to my body. So that's a really valuable thing to try.
Yeah. No, those are such great tips. I like the self-care type things too, and going maybe some non-traditional ways and reaching out to people. I always say, what's the worst that could happen if you reach out? And I'm preaching to the choir here, of course, because it's so easy to say this, but most likely someone out there will have the same feelings. And there's also a lot of Facebook groups I've noticed where women supporting women, things like that. And I'm sure there's a ton more out there where you can literally just post something and you'll get 10 replies from people all over the world, just being like, I totally understand how you're feeling. And even sometimes that validation can be really helpful. I also really like the idea of having consistency, maybe having a Zoom call with someone to eat breakfast with or eat meals with. I know that's a big thing for me in overcoming recovery from an eating disorder. That was my biggest thing during COVID, was not having that social time with eating. And it makes it a lot harder to hold yourself accountable. So having someone there to be like, hey, are you doing what you need to be doing, can be really helpful. And then you'll help them with whatever they're going through as well. So it's all mutual.
Sarah, you reminded me of a really excellent source of group support. A lot of 12-step groups are online, whether it's drinking or eating disorder, Overeaters Anonymous, Alcoholics Anonymous, Narcotics Anonymous. They're not going to ask you why you're there, and you can look up online 12-step meetings just to hear some people sharing some stories. And Daisy says, literally,
I love that.
With my friend now, eating dinner and screen sharing.
That's awesome.
We're so glad, Daisy. We're so glad.
Thanks for sharing.
Yeah, that makes me so happy. Shout out to you. Shout out to all of our content interns who are on here. And Angela, you're all fantastic. Thank you all for being here. So going into our next question, very similar. How does one go about having that intimacy when you don't necessarily have someone else there? I know female masturbation is very stigmatized, as is male masturbation to a certain degree. So how can we help to overcome that?
Excellent question.
I know, that's a really tough one.
I'll try.
Told me
Go for it. Right. This is from Angelo.
I don't know how to tell someone you don't need to be ashamed.
Mm-hmm.
You know, that's a really personal thing. Greg, what do you think?
Like 98% of people masturbate at some point during their lives. Many people masturbate a little bit less frequently when they have a committed partner or partners or as they get older. But that doesn't mean you can't increase it, vary your rate. Some folks are probably super horny right now. Other folks are less horny right now. Remember that there are some factors going on in the rest of your life that might impact that. There's nothing wrong with maintenance masturbation. You may not have felt sexually aroused for a really long time, but still want to experience the release that can come with orgasm, or just playing with your own genitals or any other parts of your body that make you feel good. That's all right. You are in charge of your own body if you are an adult, and if you don't need additional assistance from other folks, you get to make decisions about how, when, where in the privacy of your own space that you do those types of things. There are all sorts of different types of aids that you can use, whether that's visual, graphic, or auditory. I know of some apps where they have sexy stories that you can listen to. There's a specific company I'm thinking about right now, but I cannot remember their name. So if you want to hear... It is not them. It is not them. But
well, then that's another one.
So you can listen to sexually charged stories to help you get off or just feel good or know what's out there in the world. Again, you can use the apps to talk with other people. You don't have to want to meet people in order to have sexually explicit and sexually arousing conversations with them. It might be a good idea at some point to clarify that that's as far as you want things to go, or if you become aware of the fact that that's as far as you want things to go. Yeah, it's cool. There's nothing wrong with pleasuring your own body in the privacy of your own space. And it can feel really good. It has good cardiovascular benefits as well. It makes you feel good. It releases endorphins, which are the same types of things that you get from like eating chocolate or your favorite food or holding someone close that you really care about. If you can't hold someone close because they're outside of your pod right now and you really care about them, and especially if you care about them sexually and want to do something sexy with them in the future that you can't do in quite the same way right now, masturbation could be a great way to engage in all of the feelings that sometimes require another person or people in order to come to full fruition.
I will take Angela's question about maintenance masturbation. So sometimes you would like to have a feast of fantasies and maybe some visuals and maybe some toys laid out and really make a feast of it. And sometimes you really just need to grab whatever's in the back of the fridge because your body has needs. The release of orgasm, or not even orgasm being the goal, but just the physiological release of some pent-up sexual frustration is meeting a need. For some people, not everybody feels that way about it, but there's nothing wrong with, you know what, this is a thing that will help my body feel better. For some people, it's really valuable for just helping them fall asleep at night. I know we're all under a lot of stress. Many people have been having trouble sleeping. Try masturbation. Sometimes you want to really treat yourself, and sometimes you just really want to get it done, and either is totally fine. Some thoughts on toys, because toys are great, and there is absolutely nothing wrong with wanting some enhancements. There is no FDA regulation over sex toys. So it is important to understand, especially if you are inserting anything into a vagina or an anus. The vagina and the anus both have mucous membranes that are highly absorbent, and cheap plastic can leach chemicals through those mucous membranes and into your body. So if you have a cheap plastic vibrator, you can put a condom over it to avoid those chemicals leaching into your vagina or your anus. Silicone sex toys are very high quality. You don't want to use silicone-based lubricant with a silicone sex toy. You want to use a water-based lubricant with silicone sex toys. There are insertable toys. There are vibrating externally toys. There are insert into toys. If you are someone with a penis, you would like an orifice to insert your penis into. There are even some really fancy toys that are designed for stimulating a penis that may have trouble getting erect. So if you have a trouble achieving or maintaining an erection, but would still like to be able to derive some sexual pleasure, they have these neat little like cup-shaped things that you can rest a penis in that vibrates. There are all kinds of options available. And Femtasy is a store being recommended by Daisy. Thanks so much.
And that was what I was thinking about. So thank you, Daisy. That is important. Fantasy is great. Just remember their goal, a lot like Pandia, is to be a bit more female and femme-centric. So if those are not the types of stories and narratives you're looking for, there might be other audio options available to you. But if it's something you haven't tried and might be interested in hearing sexy stories that put femme and female pleasure at the center, why not? You get to make choices.
Very true. There's also a website, and I'm totally blanking on the name. It starts with a B, if anyone knows it in the comments. I know it's a female-led...
Babes in Toyland?
No. Oh, I have heard of that. But it's
I'm just going to keep throwing out sex websites that aren't the one you guys are thinking of.
It's more of a visual. It's like videos. It's different from porn because it's all female-led. It's a lot more respectful and just like a lot more... there are men in it, but I guess it's a little bit more female-focused. But it's a lot... If you're not into just watching porn on Pornhub or things like that, this is a little bit more... just a little different. Like, people have all their different needs, different things that you like, and there's nothing wrong with that. And there's also nothing wrong with if you're just not feeling sexually aroused, like, that's okay too. A lot of the time, I think stress and anxiety are correlated with lower feelings of just sexuality, sex drive, things like that. Mm-hmm. So that's okay too. Nothing wrong with it either way. There's nothing wrong with your body. I feel like we automatically are like, should I be feeling this way? But no, that's totally not.
There are no shoulds in this day and age. We are way past shoulds. Whatever you're feeling, it's fine.
Mm-hmm. Yes, it is very true. I think someone had a question a little bit, just going back to what we were talking about before. Individuals who are in codependent relationships during this time, it could be with a person, it could be with things we were talking about before, like alcoholism, eating disorders, things like that. What is a way, or what are different ways to kind of help improve with that, just feel a little bit better? Again, a loaded question.
For sure. There is actually a 12-step program for people who are recovering from codependency in relationships. It's CODA, Codependence Anonymous. And for someone who is really struggling to separate what are my wants and needs and feelings from I am trying to please someone else. I mean, there are people who are so deep in it that they struggle to answer, what's your favorite color? Well, my husband's favorite color is, I mean, that's how deeply enmeshed some people can be. So Codependence Anonymous is one resource. Also, spending some time with yourself, actively taking yourself on dates, doing a lot of journaling can be really valuable. Working on seeking out, even if it's just, how do I like my eggs in the morning? Or what's my favorite color? I like this outfit just for me, can be those little steps to helping you separate out and disentangle that kind of relationship dynamic.
Yeah.
Greg, what do you got to add there?
Yeah, I want to move back one frame and talk about, what are signs of codependency. So some of those might be that your relationship is mainly about passion and sex. You don't necessarily have an intense intellectual connection, if that's something that you're actually looking for in a relationship, and it is a committed romantic relationship as opposed to just having some sexy fun time. That's important. You need to be able to actually talk with other people about what you want and need. You find yourself being really responsive to the needs of the other person or people, and they are not always responsive to your needs or don't even ask what your needs are. That might be a sign that you're in a codependent relationship. Yep, Alec, just like in The Runaway Bride, someone or someone's in the relationship are getting all they want and need, or feel like they're getting all they want and need, and the other person kind of is like, what am I getting in return? Am I being valued? Am I being cared for? Does he, and it's usually a he, does he return my text messages? Am I always left to understand that because that other person or other people are really stressed out, that my basic needs, like a hello, are not involved in any type of way that our relationship is running. So those types of things. Remember also that you have to survive first before you can thrive. So if you're actively like in the same space with someone, you're in a codependent relationship, and there's not a good way for you to leave that physical space, or leaving that physical space right now would imperil your health, whether that is mental health, emotional health, physical health, those types of things. You don't have any other place to live. We have to do the things that you need to do in order to survive, and maybe reach out to someone or someones that can help you make a plan that may include leaving that physical space. That would be great if you could. If there's no way for you to do that in the foreseeable future, what are the things that you can do with support in order to disentangle, reclaim your own selfhood, reclaim your own sexuality, if that's part of the codependency as well. Ask for help. Help is available. There is always more help available. If you don't get the answers or the resources that you need, please keep asking until you get the help or the resources that you need. I guarantee you there is help out there.
The question of what you're getting in the relationship, are your needs being met, is a really important one, especially in, Sarah, as you said, there is a gendered element to this. And in heterosexual relationships, a study recently showed that the definition of good sex is very different if you are asking men versus women in heterosexual relationships. Most men who have sex with women will define good sex as sex where they had an orgasm. Most women will define good sex with men as one where it didn't hurt much.
That's so unfortunate.
Yeah, tell me about it.
Sad.
Everyone deserves pleasure. Everybody deserves to enjoy sex. If you are tolerating sex, get a better sex partner.
We need to talk. Yeah.
Mm-hmm.
Yeah, for sure. I like the idea of hierarchy of needs as well. It's kind of like, okay, we need to first figure out, like, yes, do I have shelter? Do I have food? Do I have all of those things? And then from there, we can kind of set a game plan. And then if all of those things are covered, awesome, then we can start working on, like, okay, how can I enjoy my sex life a little bit more? And if you have all of those basic needs met, it'll be easier to focus on that, which is awesome. Yeah, thank you for answering that question. And thank you, Angela, for asking that. It was a great question. So our last little thing to go over is for people who are new to this, like maybe new to living alone during a pandemic, being single during a pandemic, people who are maybe just getting out of relationships and kind of adjusting to that new life. Do you have any tips / good resources? I know we mentioned a few before, that you would want to say as kind of like a key takeaway.
Well, it's my first global pandemic.
Right.
So we're all in uncharted waters, and we're all figuring things out. Tips, tools, and resources. Morethansexed.org. Please, if you are a parent of children, we've got some resources for parents who need to talk to kids about sex things. There's also a lot of great materials and resources on our website. Thank you for, there's a hyphen in there, sex-ed.
Oh, oops.
I actually think that'll probably, we bought all the domains, so we'll get there.
No worries.
Scarletine.org has a lot of great materials. They do a lot of Q&A. Sexetcetera.org has a lot of excellent resources. We always love lifting up Planned Parenthood as a trusted and reliable source for information and also healthcare. My personal favorite YouTube sexologist is Dr. Lindsay Doe, and her channel is Sexplanations. If you would like to YouTube some excellent sex advice, research, interviews, Sexplanations on YouTube is a fantastic channel with a lot of great info. Greg, what else do we like to lift up and recommend?
I'll do a personal shout out to one of my dear friends, Dr. Rosario Teresi, who is a sex therapist on Long Island Sex Therapy. Look her up. She's good. She does see clients and couples and all sorts of different configurations of relationships to work through things, and also just has some great blog material and a good Twitter presence. If you're looking for some other stuff, she has a podcast as well. Check your local health department regulations about what they're saying about sex and COVID-19. I've been recommending this for several months. The New York City Health Department really led the way on some of these guidelines and has been updating them over time. Most of the major cities in the US have some really clear guidelines about what to do right now. If you have access to a college or university resources, many of their health centers are also developing guidelines around how to stay healthy sexually as well during this time. Keep in mind, just like in any other time, the only 100% way to make sure that you don't have a risk of unintended pregnancy or sexually transmitted infection transmission or spread is to abstain from all sexual contact with other people. And that means anything that can be body and genital stimulation or shares some fluids, not always saliva here in this case with COVID-19. Yeah, saliva is one you want to avoid a little bit more. With other sexually transmitted infections, that risk is not always as much of a problem. But wear a mask if you absolutely must have sex with a stranger. Choose positions where you do not face to face. If you can at all, have some type of physical barrier between the two of you. Remember, if someone's mouth is involved with your genitals, that means that you are then exposing them to droplets. And so there is a risk of COVID-19 transmission no matter what in this time, even more so than some of the other sexually transmitted infections and unintended pregnancy risks that we have right now. We understand for everyone, just abstaining or having sex with only the partner that's available to you in your pod right now isn't going to work for you. So take the precautions, but do know that the risks are elevated right now. And especially with cases on the rise, there's more ability for community spread to happen, even if it's not your specific partner or partners that are carrying the infection right now. Going to places where there are lots of other people or where you can be exposed to the droplets of people that you're not engaging in physically intimate contact can also carry a risk at this time.
Got it. Yeah, no, all good things to keep in mind. It's scary. We have never been through this. So I always say, like, yeah, err on the edge of caution. If you're going to do anything, just be safe. Use your best judgment. Yeah, so those were our main questions. Here are my key takeaways from this, and then you can put your input. So I got, check out sex toys. Don't be afraid to engage in masturbation. There's no shame in that. And if someone does put shame in that, then that's not your problem. Don't be afraid to reach out for help, not only to people that you might know, but also the self-help and 12-step program websites, things on Facebook, all of that type of stuff. And if you are feeling lonely, having consistency can be really beneficial. Those were my 3 main things. We obviously covered so many topics, and I don't want to whittle it down to that much, but I loved all of that. So do you have any key takeaways that you would like to give to the public watching this?
I guess I would add that 12-step programs are not for everyone, and that is totally valid too. There are online therapy websites, betterhelp.com, Talkspace is another one. And I know that there are more that I am not thinking of. Many of them do have financial aid available if that is financially out of reach for you. I think everybody deserves therapy. And having somebody to talk to, reaching out and asking for help is a really brave thing to do.
Mm-hmm. Yeah, I want to lift up as well that some of the ways that you're experiencing things might be related to your brain chemistry, and so you might need more or different medication right now. And so, finding someone to talk to, you might have realized that you have a new problem that never existed before. You were isolated or couldn't do as many of the things as you wanted to do before. So there might have been some type of underlying issue that is now just surfacing, especially if you're a young adult in your early to mid 20s. All sorts of mental health crises are typical of that period. That's really, really common. So it's not bad to ask for help or to be medicated for a period of time. Maybe you need a prescription for something that you only take the meds occasionally, like when you're feeling really elevated. I know in this time, acid reflux is a symptom of anxiety for me. I don't actually need any treatment for acid reflux when I'm not already stressed out. So treating the symptom helps keep me like really level. So, always talk to your healthcare practitioner, whoever that is. Make sure they're licensed in some way that makes sense to you, and they'll be able to help you figure out, do I need meds? Do I need a variety of meds? Do I need more and different? Do I need it for just a short period of time? Do I need it for a longer period of time? Does talk therapy also need to accompany the type of medication that I'm taking? There are all sorts of things that might be true right now. Go ahead, Em.
I just remembered a point that I had really wanted to make that I haven't made yet as we're wrapping up here. There is absolutely no shame in wanting a partner while you are single. You don't have to be in a relationship to be a whole, happy, healthy person. But if you want to be in a partnered relationship with someone, that's super fine and normal too. It can feel really vulnerable it can feel a little desperate sometimes to say, hey, I wish I had a partner. Being honest about that, especially with your friends and family, can increase the odds that someone might know someone who is also really lonely and afraid of looking a little bit desperate. I can think of several people in my Facebook friends list who are being pretty honest and vulnerable about, I really wish I had a cuddle buddy right now. And if you're brave enough to say, hey, I would love to be a cuddle buddy with someone that I have a friend that they can vouch for, like this person is not a creep. Great. I would love to introduce you and have you both quarantine for 14 days and then meet up in person and cuddle the heck out of each other. Being brave enough to say, hey, do you know anybody you could introduce me to? And we can write Jane Austen love letters back and forth for a while and quarantine for 2 weeks and get COVID tested and meet up and bang each other's brains out or whatever you both want. That's great.
Yeah. And if someone's willing to do that for you, very true. If someone's willing to do that for you, then they're probably a pretty good person, which is, of course, you have someone to talk to about it as well, but that's all good. If they're willing to go through that 2-week quarantine, that's not fun. So that's a good sign. And also another takeaway that I thought of as well was people do want to help. People are in the same boat as you. If someone doesn't want to help, then again, there's always more people to reach out to. And yeah, it makes people feel good to be able to help you. So honestly, you're probably doing them a service as well, even though it can feel really scary at the time. So all good things.
And you can reach out to More Than Sex Ed. We're on Facebook,
Yes.
Instagram, and Twitter, More Than Sex-Ed. Message us. We would love to say hi. We like
Absolutely.
Yay, perfect. So I'll we can write that in the chat the right way. Sorry about that. I should have asked before I typed it out. But yeah, so check out More Than Sex Ed, check out pandiahealth.com. We definitely need to do more partnerships because this was really great. And additionally, if you want to check out birth control, go to pandiahealth.com. There's a whole section on how it works. So if you have an existing prescription or you want to get a new prescription, use that $5 off code and you can have your doctor's consult as well. Very exciting. And yeah, actually taking birth control can also help to regulate your brain chemistry as well. And it can help to balance you out. So if you're not interested in going on different types of medicines like SSRIs, birth control can actually be really helpful for that. Not all of them. Check out the website for more specifics, but it can be helpful in that case. So that's pretty much it. I don't see any more questions, but if anyone does have questions, leave them in the comments and we'll kind of be looking at it throughout the rest of the evening. So don't be shy. You can also just privately message Pandia Health. You can reach out to More Than Sex Ed. And yeah, do you have anything else to say before we wrap it up?
This was a ton of fun. Thank you so much for having us, Sarah.
Of course. Yeah. Thank you to Angela and Dr. Yen and everyone who helped to set this up. This was really great. Awesome.
It's awesome.
Thank you. Have a great evening, everyone. And we will see you again, hopefully soon. Be safe and think about all of the fun things we talked about. Bye.
Wash your hands, wear your mask.
Bye.
Yes, and wear your mask. Wash your hands. Yes. Bye.
Take care.